Hi guys. So we're going to move on to chapter 9. I realized a little bit ago that I was hitting stop video, but it was still recording sometimes. So that's interesting. So you guys, I think, heard me talking to my son a couple of video lectures ago. So sorry about that. But let's talk about chapter 9. And I did play back some of the videos to here when I thought that I had paused some that I actually hadn't. So I was able to hear some of the quiet and then louder. I'm not for sure what's happening with that. So I'm going to try to be very concise. I think some of it is as I talk, I tend to um, put my hand on my face. And so we'll see if not doing that is helpful in this video. All right, so this one is also long, one of the longer PowerPoint presentations, and so we'll see how this one goes, how long it is versus the cardiac chapter. So let's talk about anatomy and physiology. This includes the chest, the lungs, and the conductive airways. There are two parts, and I believe this is on your exam. I think it asks either what does the upper respiratory system consist of, or what does the lower respiratory system consist of. I don't really remember exactly, but I know that one of them is on there. And but your upper respiratory is your nose, your mouth, your sinuses, your pharynx, and your larynx. The lower respiratory is your trachea, your bronchi, and your bronchioles, which kind of makes sense if you think about it. So anything from the lower part of your throat down is your lower respiratory, and anything of the upper part, including up into your nose, is your upper respiratory. You have alveoli. These are at the distal end of your terminal bronchioles, and there's a picture in here. And this is where carbon dioxide and oxygen exchange. Inhalation and exhalation is part of anatomy and physiology. That's just air movement in and out of the lungs. Common signs and symptoms of problems would be shortness of breath, which is dyspnea, orthopnea, which you can have rapid or slow breathing, apnea, which is an absence of breathing, sleep apnea, think of that, wheezing. Apnea can also mean like an interrupted breathing, where think about when people who have sleep apnea, where they will just have periods where they quit breathing in the night. Wheezing, hypoxemia, cyanosis, those are all different types of problems. And there's a video in here, I believe, so you can hear the different kinds of wheezing. Hypoxemia is just not enough oxygen, and cyanosis I've talked about before, which is the blue tinge to your nails and your lips, and sometimes even to your skin. Sneezing, coughing, nasal discharge. Auscultation is just listening to their breathing, their quality, and their rate. As we've talked about before, tachypnea is just rapid respirations. You can have crackles or rails, which is a musical sound heard on inhalation. Excuse me. Rhonchi is a rattling sound due to an obstruction. And this is a really good YouTube video. Let me know again if the link doesn't work, but this is a video that links to different auscultation sounds for you guys. They're going to do different diagnostic tests, chest x-ray, sputum culture. I'll just let you guys know right up front that sputum is my least favorite bodily fluid to have to deal with as a nurse. I can handle vomit, urine, feces, most anything, blood, but when people start like trying to get a sputum culture, I don't know if any of you guys have ever had to give one, or I'm sure you probably haven't had to collect one, but when people start to like try to get that stuff up, I just have a hard time with that. And different nurses will tell you that there's different things that bother them, but that's mine. They'll do a tissue biopsy, bronchoscopy, arterial blood gases. Those are somewhat painful to get. Pulmonary function tests. This is a bronchoscopy. This is just kind of showing you how that goes down into the lungs and helps them to look at that. So here we go again with smoking. This goes to diseases of the upper respiratory tract. Smoking is the #1 risk behavior for developing chronic respiratory disease. You can get upper respiratory infection, usually acute illnesses, most commonly caused by the rhinovirus. And again, smoking isn't going to cause an upper respiratory infection. It just makes you more susceptible to it because your lungs aren't quite functioning the way that they should. And again, no judgment here about people who smoke. If you smoke, that's, your decision. I'm just providing you with education. And in turn, you can provide that to your clients. Upper respiratory infection treatment, rest, fluids, medicine for fever, medicine for pain, and antibiotics for any infection if it's caused by a bacteria. And then preventing this, regular hand washing. So another question that's probably on your exam is about hand washing. And anytime you have a question that talks about how you can prevent infection, hand washing is going to be your #1 answer. So there's other things that can happen to the respiratory tract: the common cold, hay fever, sinusitis, pharyngitis, and laryngitis. There can be some diseases that are more severe than upper respiratory infections. Some can be life-threatening, and others, like any other thing, can be more dangerous in older populations. There are different diseases. Let's talk about asthma a little bit. I know one of you has this, I believe, as your topic for your final project. This is a hypersensitivity reaction that's going to make the bronchi constrict, leading to difficulty breathing. They're going to have episodes of wheezing and shortness of breath, and we want to, again, help them avoid those causative allergens. We can do allergy shots, desensitization to that, and medications. And prevention, the only way to prevent it is to identify and control those allergic factors. Example of that is, I know a little boy who is severely allergic to scents like perfumes, candle scents, things like that. And so in his family, they can't have scented lotion, they can't have scented candles, they have none of that in their house, and it helps him with his asthma. Acute bronchitis is an inflammation of the lining of the bronchus. This is short-term, usually following an upper respiratory infection, and they're going to have a tight feeling in their chest, and a productive cough, and a fever. Rest, increased fluids, cough syrup, kind of the same as before. Medicine for fever, medicine for pain, and antibiotics for any secondary infection that they might get. Influenza, we're coming up on the flu season. This is a highly contagious respiratory infection, a viral disease with many strains. They're going to get fever, chills, headache, back and muscle pain, cough, runny nose, sore throat, sneezing, hoarseness, can get nausea and vomiting and diarrhea. Symptomatic treatment is really the only treatment for this: rest, medicine for pain, medicine for fever. There are antivirals that you can get if you catch it very, very quickly and you know that that's exactly what it is. So there is a question on your exam about the difference between the cold and the flu. So you do need to know the difference. This is for you visual learners out there. It's not common in the flu to have a sore throat, but in a cold, there's a high probability of that. Now, can you get a sore throat with the flu? Yes, because some people have coughing and things like that. It's just not, that part is not as severe with the flu. The most common thing that I see the difference with the cold versus the flu is, in the flu, you're going to have a fever, you're going to have chills, and it's going to develop very, very quickly. Versus a cold, you're not, typically, you don't get a fever, you're not going to have the chills, and it's just not going to be as severe. Chest discomfort is going to be severe with the flu, and but with a cold, it's going to be more of that cough, you're hacking, it's usually pretty gross, you've got a clogged nose, you just don't feel well, but with the flu, you've got that headache, you've got a fever, your body, the body aches are what I hear people say the most that is bothersome to them. Here's another thing for you guys to visualize for the difference between the cold and the flu. All right, so let's talk a little bit about COPD. COPD is kind of a triad of emphysema, asthma, and chronic bronchitis. They kind of overlap there. So, like I said, it's a group of pulmonary diseases primarily due to cigarette smoking. Can people get this that didn't smoke? Yes. Is it very likely? No. Two most common types, chronic bronchitis and emphysema. They're going to diagnose this by a history and physical. They're going to figure out your smoking history, do a chest x-ray, pulmonary function test, and arterial blood gases to figure out how the blood is transporting the oxygen for you. They're going to give you inhalers to open up your bronchi. Those are the bronchodilators. Inhalers like fast-acting inhalers to open that up also. Mucolytics to take down some of that mucus that's down there in your lungs. Cough suppressants. You want to not get sick, so you want to avoid people who are sick with an upper respiratory infection. You want to get the flu vaccine and you want to quit smoking. So here's a visual for you guys on the effects of COPD. Look over there, depression in that right corner. Think about why people get depressed with COPD. A lot of that is they can't do what they used to do. Here's another visual for you guys. They're easily fatigued. They have pursed lip breathing. They're wheezing. They've got a barrel chest. They have to use their accessory muscles to breathe. What that means is they're using all, instead of just their chest going up and down with each breath, you might see them use their side muscles to try to get a good breath. So here's a little picture about smoking and emphysema. These are healthy lungs, healthy alveoli. Then those harmful particles get trapped in there. It triggers an inflammatory response. Then you get inflammatory chemicals. And then you get a large air cavity that's lined with carbon. Those deposits form, and then you get emphysema. Chronic bronchitis is an inflammation and scarring of the bronchial tubes. You can get a pooling of mucus and a foul-smelling cough. That's a smoker's cough. Emphysema is just an increased production of mucus causing air trapping in the alveoli. There we go back to that pursed lip breathing and the barrel chest. Atelectasis is a collapse of airless state of all or part of the lung. This can be caused by surgical pain, fractured ribs, a blockage of airway by a mucus plug, and they're going to give them something for pain, have them do frequent deep breathing and coughing, and have them get up and walk around. Pneumonia. This is an inflammation of the bronchioles and the alveoli due to infection, sometimes a virus. I think, though, most often it's a bacteria. There can be other areas involved, or it's related to the area in the tissue involved in your lungs. This is diagnosed by a sputum culture, chest x-ray, so that they can see that pneumonia in there. Treatment's going to depend on the cause. Prevention, of course, not smoking, frequent hand washing, wearing a mask. For people, I want to say it's 55, it might be 60 and older, there is a pneumonia vaccine. There's pneumonia. It basically shows you got fluid built up there in the lungs. So if you have fluid in there, can you get good oxygen? No, because the fluid is where you need to be, you need oxygen, you need to be making oxygen exchange there. Tuberculosis, we don't see this anymore, but there used to be a TB hospital in Mount Vernon. They've since closed that down. But when I worked there, oh gosh, it must have been 15 years ago. and there were still people there with TB. This is acquired by breathing the air infected with TB, and so those people would be on extended antibiotic therapy, and they're going to be in a negative pressure room because it can travel. There you see the little tubercules in their lungs. That's how they diagnose it. ARDS is adult respiratory distress syndrome. This is going to be the result of a severe trauma, and they're going to need mechanical ventilation, or they're going to need help breathing, and they're going to have sudden and extreme shortness of breath. That's what dyspnea is. And this is can be very fatal even with the best treatment. So it's severe, easily transmissible new disease caused by a previously unknown type of coronavirus. Antibiotics are ineffective. It's a viral infection, and this may require ventilatory support. I don't know if any of you guys heard of SARS years ago. Lung cancer. This is the leading cause of cancer deaths in the United States at the time that this text was written. So I'm going to preface that because it does change. This is often asymptomatic until it goes to the brain, the bone, and the liver, and it's most often caused by cigarette smoking. Now, does that mean that it's always caused by cigarette smoking? No, because as we know, the guy who played Superman, his wife died of lung cancer, and she never smoked. Symptoms can be shortness of breath, coughing up blood is what hemoptysis is. They're going to diagnose this by x-ray and taking a biopsy. They're going to do chemotherapy, radiation, and surgery. But in my experience, in my history, and I'm sure that this probably isn't 100% accurate, but it's going to be close, that pancreatic cancer and lung cancer are two that are pretty aggressive and pretty hard to treat. And so unless they find them very, very early, the longevity range of those is pretty low. All right, some more diseases of the lungs. Pleurisy is just an inflammation of the membranes that's covering the lungs. What's funny is I knew this lady who said that she caught the pleurisy. She's like, I caught the pleurisy. And obviously she didn't catch it. This was an inflammation of the membranes covering her lungs, so it wasn't something she could catch. But you see there that it says pleuritis, but we've talked about itis. Remember, that's always inflammation. A pneumothorax is an air in the pleural cavity. My husband had pneumonia, probably 4 or 5 years ago now, and he ended up with a pneumothorax from the pneumonia, and they had to go, no, actually, you know what? He had a pleural effusion. He had fluid in there, and they had to go in and drain the fluid off. I just remembered. It was very neat to watch. I wish they would have let me sit in on the whole thing, but they wouldn't let me. A hemothorax is blood in the chest cavity. Pleural effusion is fluid there in the chest. And empyema is just pus in the chest cavity. That would be pretty interesting. Air in the pleural cavity is just going to deflate that lung. So what they want to do is they want to get that air out of there so that lung can maybe reinflate. You can also have a pulmonary embolism. This is a sudden blockage of the artery by an embolism. Pulmonary edema, tissues and air spaces of the lungs fill with fluid. And cor pulmonale, which is right-sided heart failure from respiratory problems. We don't really need to talk about pneumothorax and hemothorax. Suffocation, this is trauma. This is not breathing to the point the individual loses consciousness and eventually dies. This can be caused by many things: drowning, strangulation, aspiration, which means that they've choked on something and they can't get any air in. There are some different fungal diseases that you can inhale them into your lungs, and it's a fungus. I'm not going to go over them in depth. Histoplasmosis, I want to say, is caused by something in cat litter boxes. Don't quote me on that, but I'm pretty sure that that's what that one's from, but you don't need to know that for your exam. Legionnaire's disease is a bacterial pulmonary infection. It's not limited just to the pulmonary system. It can cause damage to other systems, but I just left it in here so you guys would be aware that it's a problem with the a respiratory disease. All right, so effects of aging. They can have decreased elasticity in the respiratory system, which means that they can't get enough air. They don't have enough air reserve. Weakened respiratory muscles, reduced resistance to infection, and again, smoking is the major cause of high incidence of lung cancer. So I put this in there. This is how much I don't know who smokes, if anybody in this class, but for clients, anyone who smokes, this is what happens when people quit smoking. Within 20 minutes, their heart rate drops. And within 2 weeks to 3 months, their heart attack risk begins to drop. After 1 year, their risk of coronary heart disease is half that of a smoker's. After 10 years, their lung cancer death rate is about half that of smokers, and their risk of cancers of the mouth, throat, esophagus, bladder, kidney, and pancreas decrease. And look there at 15 years, the risk of coronary heart disease is back to that of a non-smoker. So it does make a difference. You know, it does take a while, 1 to 9 months before their coughing and shortness of breath decrease. But 1 month, they could be feeling better. All right, just let me know if you guys have any questions, and that you have one more video lecture for this module, and then you'll have your exam. Just please let me know if you have any questions.